lived in Morristown my whole life. I have a daughter and a son-in-law and 2 granddaughters. In 2014, July, that's when my whole life changed. I just got up one morning and was just walking down the hall, and I just said, ouch. And I reached up and I felt the lump.
Well, Patsy's case is very interesting in the fact that she had had a mammogram previously that was negative, and all of a sudden, in the interval between when she was supposed to get her next mammogram, she felt an abnormality in her breast, and the biopsy revealed a fairly aggressive cancer.
She presented with a sizable tumor in an area of her breast that frankly is difficult to deal with cosmetically from a breast conservation standpoint. And then upon further investigation, it was clear that the tumor had spread to the regional lymph nodes.
The day that I met with Dr. Thompson, he explained exactly what my tumor was and explained to me, the treatment that I would get for that type of tumor. He explained it to where I felt like I could understand.
We try to give them accurate, understandable information that can help them participate in the decision-making process.
And then he said, you have the option to get a second opinion or go anywhere else. And I said, I don't feel like I need one. I just felt like there wasn't any place any better to go. This is where I wanted to be.
Patsy's case was reviewed at our Multidisciplinary Tumor Board. That's where all the physicians meet, including radiology, medical oncology, surgical oncology, and radiation oncology. It allows all of us to have our input to make sure we do the best possible care for the patient.
After I had my biopsy, Dr. Thompson explained that I would be going through chemo, then surgery, then radiation.
In that setting, she has an aggressive cancer, and we felt it best to proceed with what we refer to as neoadjuvant chemotherapy. And what that is, we give the chemotherapy before the surgery, and the advantage of that is that we can get shrinkage in the tumor, but also we know how the tumor responds to the chemotherapy. So patients who get a very good response tend to have a much better prognosis.
The very first day that I went into the chemo room, of course I was scared, very nervous, because I had no idea what to expect. But the nurses in there were just super. They made you feel very comfortable. They were there if you needed anything.
When she completed her neoadjuvant therapy and was ready for surgery, then we were able to perform the surgery in such a way that it was much more cosmetically acceptable, because not as nearly as wide an area required excision at that point.
Now that I'm cancer-free, I'm trying to get my life back the way it was. It's hard because I'm still scared. I still have the fear that the cancer will come back, but I'm so proud and happy that I am cancer-free now. From the first person that greeted me as I walked through the door till I went through all of my procedures, everyone was super. I could have never asked for anybody to be any better to me and more caring. If anyone ever came and told me that they had been diagnosed with cancer and what I felt like they should do, whether they should try to go to another treatment center or stay here at the Morristown Cancer Center, I would definitely tell them, stay in Morristown, because you're going to get the best care that you could ever possibly get.